session. A very good morning to all my dear students. I welcome you all into the industrial pharmacy first. Dear student, we are on to the ophthalmic preparations, and while studying this in our yesterday's lecture, we had gone through that what are the ophthalmics, what are the commonly used and the newly used dosage forms, what will happen to the instilled dose into the eyes, what are the different ophthalmic preparations, mydriatics, myotics, cycloplegic, anti-inflammatory, anti-infectives, then anti-glaucoma, adjuncts, diagnostic drugs, and the anesthetics. Then we saw the anatomy and physiology of the eye, where we saw the different parts of the eye and what the things are happening with that of the drug in case of the fluid in the tear. So in this, if we will see the 5% or even less than that of the 5% absorption that will offer through the ocular route, and some 50 to 100% drug that will get absorbed by the systemic administration or the systemic route. Right. So then we had gone through the different parts of the eyes and their functions and how they will perform, what they are, what are they. Like say the sclera, cornea, choroid, then the iris, then lens, retina, macula, and the eyeball. Eyeball that is responsible for dividing the eye into the two chamber, that is anterior and the posterior. Anterior that is the small section, posterior that is the larger section. Anterior that will contain the aqueous humor, posterior that will contain the vitreous humor. Then we saw the different factors affecting the drug availability in case of the eyes. So in that, the first factor that is the associated with that of the blinking activity, gravity induced lacrimation, and the normal turnover of the tear. Further, we saw the diagrammatic representation that how the lacrimal drainage that will occur, how the drug that will travels from eyes into the nose through the lacrimal ducts, through the lacrimal sac. Then we saw the absorption in case of the low permeability as far as the cornea is concerned. So where the lipid barrier is the condition, and then the hydrophilic macromolecules, they will get absorbed through the sclera, and the lipophilic that is through the cornea. After that, we had gone through the fixed first law of diffusion, which is relevant as far as the ophthalmic preparations are concerned, where it is J is equal to minus capital D multiplied by small d capital CM divided by small dx. And what these are and what is their relation, that already we saw. Then there is a corneal absorption. As far as the corneal absorption is concerned, the drug bioavailability that is very, very poor. That is because of the different challenges, because of the different hurdles. And what these challenges and hurdles are, that is the protective mechanism of the eye itself is a first challenge, that is the blinking and the reflex lacrimation along with the nasolacrimal drainage. After that, the anatomy of the eye, like say the liquid or the drug or the drop holding capacity or the barrier of the cornea. So all these are the anatomical features associated. Then there are some of the safety considerations during the process of formulation of the ophthalmic preparations. In that, the very first, that is the sterility. So sterility, that is the complete freedom absence from that of the microorganisms, and in order to get the complete sterile product, there is need to terminally sterilize in the final packaging the product. That is the Formulation along with the container, it need to be terminally sterilized. Terminal sterilization, that is the after the process of the final packaging. Only the few are stable to the normal autoclaving temperature and the time, that is 121 degrees Celsius for 20 to 30 minutes. That can be packed in glass or other heat deformation resistant packaging. The ophthalmic products that are aseptically manufactured and filled into the previously sterilized containers in aseptic environments using the aseptic filling and the capping techniques. So there is a need to go for the aseptic filling and the aseptic manufacturing. What are the different methods of sterilization that are very commonly used? In case of the ophthalmic, the radiation, filtration, and the autoclaving. That is autoclaving, filtration, and the radiation. These three are the major method by which we can go for the process of sterilization. But every method that has its limitations, like say autoclaving, that is not suitable for the heat label material, whereas filtration method that is not suitable to that of the membrane, to that of the suspension, because the filtration membrane that will retain the particle and the dosage formulation that is the suspension, so it may not be suitable. Then the last option which will remain, that is the radiation method. The ocular toxicity and irritation, again, it is one of the consideration while designing and developing the ophthalmic dosage form. Albino rabbits, these are used and the for the process of examination of the conjunctiva and the cornea or the iris. So the containers are cleaned and sterilized as in the final package product and extracted by submersion in the saline and cottonseed oil. The topical ocular installation to the extract and the of the extract and the blanks in rabbits is completed, and the ocular changes that will be examined. So in order to detect the ocular toxicity and irritation, these albino rabbits are going to be used in order to perform this particular kind of examination. So the reflexes that will be noted. Then preservation and the preservatives. The preservatives, these are included into the multiple dose eye solutions for maintaining the product sterility during use. Because when the container is going to be open, at that time the chances are there that the product may contaminate. So in order to prevent the process of further growth and multiplication, there is a need to go for the, what to say, that addition of the preservatives. Preservatives that are not included in the unit dose package. Preservatives, these are not included into the unit dose package because say the preservative that may be damaging, that may be harmful to that of the cornea. That's why in case of the unit dose package that may not be included. Preservatives are used to maintain the sterility of the product, and the preservatives are not included into the unit dose package. The most common organism is the Pseudomonas aeruginosa that grow in the cornea and may cause the loss of vision. So that is the reason. Ophthalmics that may be packed in multiple dose and do use for the individual use of the patients. So the first dose that should be sterile, and the contamination may occur other dose that may cause the infection. So we need to add the preservative to control the growth of microorganism in case of the multiple dose preparations, multiple dose products. Generally, the EDTA, that is the disodium edetate, EDTA 0.01 to 0.1% concentration, that is to be used along with that of the benzalkonium chloride, that is 0.1%. But generally the chelating agent, so this is the benzalkonium chloride 0.01%. So the combination that is going to be used, and this will going to act synergistically. It is generally the